So Rick, thank you so much for joining us and for giving us your experience with Pinnacle. So tell me what your symptoms were before you got treatment here at Pinnacle for your vertigo.
Well, let me tell you just a little bit of history, if I could. The history, I'm late 60s, have not really had a lot of vertigo. The first time I had vertigo was a couple of years ago, and they gave me the regular things like you'd wear a patch if you go on a ship, and it kind of went away. And my grandmother had it for years, but that was the first time I ever had it a couple of years ago. And then it cropped up this year in roughly January, February, and throat doctor, he thought, well, you've got a different kind of vertigo, and it's not inner ear. He had a big name for it. And he actually put me on some type of drug called nortriptyline, which was an antidepressant drug. And it did help, but it didn't last very long. I got out of bed. I could not stand up. I couldn't walk. I had to hold on to the bed, hold on to the chair, hold on to the wall. It was just horrible. I couldn't hardly function. So I called my ear, nose, and throat guy again, and he said, well, we don't have any other real treatment. So he sent me to my neurologist. And so my neurologist ran every test she could to see if my brain was functioning correctly, if my balance was good. She did a full MRI of my head, my inner ear, everything. No telling what Medicare spent on that. So she couldn't find anything wrong. Well, by pure chance, I was talking to my pharmacist, and my pharmacist had told me about this procedure that someone had done on her husband. She didn't know exactly the name of it, but she described it, and she had given me some people to call, and one of the people was Brian. And so I went out to Brian. He said, this is the price, and the price was about what a call would have been to an ear, nose, and throat doctor that did this. I checked out the price, and so he did it to me the first time, and it took probably 10 minutes, 15 minutes, and it fixed it immediately. It was immediate. It was a method of going through some procedures. So I laid down on a table, and then he turned my head a certain way. Absolutely fixed it. And then I had to sleep that night in a chair about 45 degrees, not laying on my side. And that was a little bit hard to do, but I got used to doing that. I did it twice. And then the price that he charged me for a second visit. So on the second visit, which was 2 days later, I did it again. I really probably didn't need it, but he did it again. And that's been a month or two ago. And I totally have no symptoms currently. None.
Wow, that's awesome. Was the procedure painful at all for you, or was it pretty comfortable?
It was very comfortable. There's no pain at all.
Okay, good. And what would you say to other people who are considering coming to us for their vertigo?
I would say that the doctors, for some odd reason, maybe money, want you to come in, and they want you to they want to bill you for all kinds of stuff. There's no telling what the neurologist charged with a full MRI. There was no telling what the ENT doctor was going to charge. There's just no telling.
Thank you so much for taking the time to tell this story, because this is just exactly the type of thing that we see happen all the time. And we love the fact that we can help people, and you don't have to go see your doctor first. You can save the money, you can save the hassle, you can save having to buy all those prescription drugs and taking them, putting them into your body when they're really not necessary. It's quick, it's painless. And your story is just awesome, and thank you so much. Hopefully it'll reach a lot of people, and we'll be able to help a lot of people from this. So thank you so much, Rick. I really appreciate it.
Well, I hope it does.
Okay, thank you so much, Rick. Have a great day.
All right, you too.